Boost Health Talk na the program wey dey bring to you well body business na the country. Inside dis program, master sabi pipo dem get for dey tell fambul dem wetin dem wey dey support well body one, dem go also tell fambul dem wetin dey spoil we well body one. Make we no forget say fambul dem sef
Sierra Leone, because as you know, diseases does not have borders. I mean, of course, we have had events like the Ebola outbreak. We saw how it spread from Guinea, Liberia, and then Sierra Leone, and even the COVID as well. So that is why we pay key attention in monitoring those disease threats. And at the moment, we have two global events that are occurring that we are also monitoring. The first one is the hantavirus, which we from the cruise ship that we all know that has been in the news over the past week, and also most recently Ebola virus outbreak that occurs in DRC and Uganda, which we got that notification on the 15th, and since then we have been monitoring those two events, and we have also sent press releases out informing the public and also guiding them as to the precautionary measures that the public should take. And for in-country, we actually have currently we have measles outbreak that's actually going on currently in country, and also for that one we have a press release that we actually issued out again with regards to the situation. And when it comes to so when it comes to the hantavirus, of course, WHO received a notification on the second with regards to what we call severe respiratory illnesses among um, cruise ship members, both the crew and of course those that are on board the ship. And later it was actually confirmed to be antivirus, and specifically the Andes strain that was confirmed in South Africa and then in Switzerland. But as to date, they have up to like 11 cases that have been reported with 3 deaths. Of course, for Sierra Leone, the risk is very low. The reason being that actually the outbreak occurs within a confined space. That is among within those ship, the ship actually, that is where the outbreak occurs, and a lot of public measures has been taken by the respective countries and including WHO to ensure that it does not escalate. And of course, all the contacts on board the ship are under strict follow-up and they are currently being monitored. So as a whole, the risk for Sierra Leone is low. So that is something that should not cause panic or alarm. And of course, on the agency part, we are also monitoring the situation closely. We have intensified surveillance in our border points to ensure that if we have a suspected case, we are able to detect it on time and then report and mount a response measures quickly. And just basically for us, I don't know, hantavirus basically is like a zoonotic disease. What do we mean by zoonotic disease? It means it spread from animals and to humans, and mainly from rodents. You get it from rodents. That is when you come in contact with the droppings. Just like I know we all are familiar with Lassa. I mean, Lassa also spread through rodent. When you come in contact with their droppings, it could be their urine, their feces, and if they contaminate food that we eat, you don't cover your food and all the rest together. It's a similar thing with the antivirus that is actually transmitted through rodents. And when you come in contact with that, human to human transmissions is limited and it normally occurs due to close contact with an infected person. I mean, that's when you actually get that one. And the disease is actually not endemic in Africa, but more East Asia and the Southern American region. That is where the disease is actually endemic. So Africa, we actually it's not endemic in Africa, but that does not mean we don't have the species of rodents. It means that we need to continuously monitor that whether we can do rodent trapping and try to detect it on time. So that's it for answer. The screen, I think we are having issues with the screen. That is great. Do you have any issues with the screen? Coming on. Let's see. I think. Yeah. That's good. Okay. I think. Yeah. Sure now. Okay. So for the Ebola virus, of course, I believe we are all not strained to Ebola. We know what happened in 2014, 2013, 2014, up to 2016. We had massive outbreak in the West Africa region, specifically to Guinea, Liberia, and then Sierra Leone. We had a lot. I mean, I believe most of us that are sitting here must know a family member or a friend that actually died from Ebola. But this time around, the strain that is being detected is different from the strain that we got in Sierra Leone, and that is the Bundibugyo strain. And currently, two countries, as reported, started in the Democratic Republic of the Congo, and then later there's a case that moved to Uganda. So Uganda has currently reported two cases of the disease as we are speaking. And while in the DRC Congo we have over 246 suspected cases, and out of which we have 80 suspected deaths and 8 confirmed cases out of that. And out of the 8 confirmed cases, we have 4 that have died of the disease. Then we have healthcare workers that are also infected and also died of the disease as well. And in Uganda as well, like I mentioned, they have 2 cases, but these are imported cases from DRC to Uganda. And the other thing that is different from this strain compared to the one that we have is that there is no vaccine. The one that we have, we have been able to develop vaccines for that one, but this one is still under development and even treatment. But however, with early detection and supportive care, it can help a lot in terms of saving lives as well. And for Sierra Leone, we have been classified as low risk because of our geography. The DRC is eastern part of Africa, which is really far away from Sierra Leone. So that is why we are low risk. But that said, these days people are traveling a lot. People are traveling a lot. And like I mentioned earlier, diseases does not have borders. It just take one flight. And that is why we have intensified, which the ED will mention, we have intensified our surveillance within our point of entries to ensure that we screen people that are coming and know, especially those that are looking for passengers that are actually coming from DRC and then from Uganda. Those ones we can pay more close eye on them because we don't want to see what what happens in 2020, 2014, 2015 to repeat itself. That is why we are being so vigilant. And I believe all of you seated here will actually help the agency to ensure that spread the messages out, make sure that communities are aware and also report. So they see suspected cases. We have given out our case definitions out. So should you see a suspected case, it's very important that communities report that one. Yeah. So that's it for Ebola. For measles, like I mentioned, measles is actually a childhood illness, and that is something that is vaccine preventable. If you ensure that your child before they turn 1, they take their vaccines, actually prevent you having. And normally, areas that are overcrowded, poor ventilations, those are all risk factors. That is why it's good that we ensure that we have the herd immunity, that we have over 95% of our children, regular children, are vaccinated and develop that high immunity. It prevents others. So that is why the message that we want from here is that, send especially to our parents and others that caregivers, family members should ensure that they take the children for vaccination because that's the only way we can prevent measles from occurring. So far, nationwide, we have reported 144 suspected cases. Out of those cases, when we test them, we have 44 that have been positive, and across 8 of our districts, that is Bo, Kenema, Falabar, Kandia, Tonkolili, Western Area, Western Area, but the bulk of the cases are in Western area. So that is something that we need to know. And when we look at vaccination, we really see that we have a lot of missed children that are not coming for vaccination. Those are some of the messages that I really think we can emphasize on making sure that our children come for vaccination. Because measles is preventable. And the other thing about measles is that it has a lot of complications, especially in young children, and also the people that are malnourished or their immune systems are down, and in pregnant women. And if in fact in children, it can cause even blindness in children. So that is why we really need to take it seriously and make sure that our children get the vaccines. The vaccines are available in.
Morning. The World Health Organization declared a public health emergency of international concern in response to the active Ebola virus disease outbreak in the Democratic Republic of Congo and Uganda. I want to address the people of Sierra Leone directly. Sierra Leone has no confirmed, no suspected, or no probable case of Ebola. We are currently Ebola free. Let's get that straight. Sierra Leone is currently Ebola free. What are we not? Is Sierra Leone is not unprepared. The current outbreak, as already highlighted by Dr. Squire, is caused by a very strange strain of the virus, the Bundimoyo strain of the Ebola virus. It is a rare strain for which there are currently no licensed vaccine and no approved therapeutics. This is important to context. When WHO declares a public health emergency of international concern, it does so because the outbreak requires coordinated international support, not because it poses a high risk to the global public. Indeed, WHO has explicitly advised against travel or trade restrictions outside the affected region. This is not a pandemic. It is a serious regional emergency that demands serious regional actions. As of the 16th of May, 2026, the DRC has recorded 246 suspected cases, as highlighted by Dr. Squire.